YouTube family. It is I, Sanika. How has everyone been? Oh my goodness, I just took off my oxygen to fix my glasses and stuff, and forgot to put it back on. Okay, deep breath for the baby. So, how has everybody been doing? Oh my goodness, I miss y'all so much. I miss talking to y'all. I really don't have anyone to talk to about my pregnancy, like really, since I haven't told anybody. But I am 8 weeks and 3 days today. Yay! I didn't mean to shake the camera. And let's go over my 7 week symptoms. Okay, 7 weeks. What's to report? Of course, nausea, vomiting, fatigue. My breast still hurt. Saliva, y'all. I have so much saliva going on in my mouth. I'm constantly spitting, and if I'm not spitting, I have to drink to try to take away the spitting. What else? Discharge. I have discharge pouring out of me that has not stopped. Doctor says normal. It's part of pregnancy, but it is just so gross to me. And I'm allergic to pads, so I can't wear pads, and it's so gross to me. I'm still spotting. I notice I have brown specks on the applicator when I insert my applicator with the Crononin every night. Did I say fatigue? Fatigue. I'm in bed by 8 o'clock, and I feel like I'm just like pooped, like drained. 8 o'clock. But I always wake up at around 12:01 because I'm just so hot. I just get overheated and I'm sweating, and no matter, I have to, like, the weather is crazy here. I mean, you see I got this big old sweater on right here with my Saints. Hallelujah. But yesterday it was 68 degrees yesterday, y'all. Nice. Windy. It was nice. Had the window down when I was driving around. So nice. Today, 38. Like, what? Only in the South. Only in the South. What else? Bathroom. I have not had a bowel movement, and today's the 5th day. Yes, 5 days, no bowel movement. I take my Miralax. I was taking half a cap because that's what I've been taking since before I was pregnant, because I couldn't take it a full cap because the side effects was like really hard on me. Like, I had no control sometimes over my bowels. So my GI told me, take a half a cap, and that's what I was doing. And now I'm stopped up 5 days, haven't went to the bathroom. So I saw my high-risk doctor, y'all. Monday was my first time seeing her. But she told me to go ahead and take a full cap because, the pregnancy is making it even harder now for me to have a bowel movement. Also, going to the bathroom to urinate. I can't hold my back. I can't hold it. I cannot hold my urine. My bladder gets full just by taking a few sips of this, and then I have to run to the bathroom, y'all. Like, I cannot hold it. And then I can feel, I'm sorry, y'all, that spit is just gross. I can feel like the my uterus sitting on top of my bladder. Like, I can actually feel it. And then it's like sometimes, like, if I didn't know that I was like 8 weeks pregnant, I would swear that it's the baby kicking my bladder, but I'm like, it has to be my bladder just like spazzing or whatever. But I just feel like these little spaz that makes me have to go even quicker. And like, if I don't go, I will use the bathroom. I almost used the bathroom myself yesterday at the acupuncture office because she was taking forever to take them needles out. And I was like, you got to hurry up and get these needles out because I have to use the bathroom. So I'm like, hurry up and hurry up. So she got that last needle out, and as soon as I got up, I felt a little squirt. I was like, oh my goodness. And I'm just got a gown on. I ain't even care that all my back, all under there was just out in the back. I just ran to the bathroom. So it was, y'all. And also, I'm still spotting. I think I mentioned that. I'm not sure if I did, but I'm still spotting also. So when I went to my high risk doctor, my MFM, Monday was my first appointment. When I went in there, she told me about everything. She told me all my risk and, you know, basically, I can most likely I will have the baby early, and there's a chance that I can have the baby at 23, 24 weeks. That was just basically the gist of it. And then she told me that she wanted to test me for pulmonary hypertension. And she's like, if I have pulmonary hypertension, that's a whole new ball game. She was like, if you have pulmonary hypertension, I would suggest that you terminate. She said, because there's a 30% and a 50% chance of survival. And she said, and I give a 50% chance because of all the other stuff that you have going on. And I was like, I didn't even say anything. I just sat there and listened. So she's like, I want to go ahead and get you tested. You got to have an echo. So she gave me an echo that day. I had to go to the cardiologist. They got me in. And she was like, she didn't even want to talk about anything else that had to do with the pregnancy until she got that echo back. So, excuse me. So the appointment ended there. Went to go get my echo. And I had to go give blood and all that. And then she had another appointment today, Friday. Excuse me, y'all. I'm serious. Oh, my stomach. So she did that Friday. So today went in. She said, well, all these tests came back normal. She said even the test that I requested from UMC, she said all that. She said it shows good functions in your lungs. She said like, it's not perfect, but it's good enough to where I think with a close watch on you and good care that you can sustain this pregnancy. She was like, I hope we can get to you to 37 weeks. And I was like, oh. And she could tell, she was like, oh my goodness, you're smiling. She said, last time you was in here, you just had this dead serious face. She said, and I was like really worried about you. She said, but you're smiling now. And I was like, because now there's something positive out of all this. It's like, I knew this because one, I said, my faith tells me that everything is going to be all right. God did not bring me this far for me to be that 50% and for me to terminate my pregnancy. He didn't bring me this far for that. No, he wouldn't do that to me. No, God loves me too much to put me through that. I honestly believe that this is my take home baby and my rainbow baby, and I will be okay. If I don't make it to 37 weeks, I believe I'm gonna make it to the weeks to where my baby could come home in the hospital with me, or even if he or she don't, he or she still coming home and I'm gonna be at home taking care of it, So I told her, I was rebuking everything that you told me in the office. I said, but I just sat there and let you talk because obviously you had something to say. And she was like, okay. So she also was telling me that she still has to find me an OB, and she was asking me what was my preference, as woman, man, older, young, And I told her I really don't care as long as you don't give me Dr. Stewart because I do not like her bedside manner. Y'all, she was just so rude. She had my first pregnancy when I was living down here and the one I miscarried. She was so rude. When I went back after the miscarriage, and then she was my sister's doctor, and when my sister was having a baby and she was pushing out and everything, she was rushing my sister to hurry up to have the baby so she can go and be with another patient that was across the way who was about to have a baby. And come to find out that was like one of her friends or whatever. So she was trying to rush my sister to have her baby, and my sister was having her naturally because she messed up her epidural 3 times. Don't get me started. So I just told her I did not want Dr. Stewart, and she said why, and I told her I don't like her bedside manner, and she said, a lot of people don't like that she's blunt. It's not about being blunt. You could be blunt with me. I don't have a problem with you being blunt. My problem is how you deliver it. Everybody could be blunt and say if you're gonna deliver it wrong and be rude and no, and inconsiderate, no, you're in the wrong field. You messing with pregnant women. You're in the wrong field. So she told me she'll find me a doctor and she'll let me know. Anyway, so she went over my pulmonary test. I told you everything came back fine. Hallelujah. Then I started telling her about, one thing I forgot to mention was that I had a fatty liver. And she said, well, that could mean gestational diabetes. So I want to go ahead and test your sugar. So I was like, okay. And then she said, do you have time to do that today? And I said, yeah. And I was telling her that I was spotting. And she said, well, let's check for a heartbeat. And then she was like, well, there's a 95% chance, like, once you see the heartbeat, that, everything's going to be okay. And I was like, yeah. And as I was waiting, and I was like, yeah. So she was like, let's go ahead and get you to see the baby. And y'all saw my baby. And here she is. Look how big it done got, y'all. Oh my goodness. Look how big it is. I mean, look at this compared to when it was 7 weeks. Like, oh my goodness. Look at that. It like doubled. Isn't that like awesome? Everything is awesome. Love it. So heartbeat was 172. Hallelujah. So everything was fine with the baby. When they got my gestational, took that orange flat sun kiss, drank that, went back an hour later, got my finger pricked. As I'm sitting there waiting for the results, tick, 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 tick. I said, so what's normal? She said, anything under 140. I said, so 141 will be considered abnormal. She said, yes. I said, okay. As soon as I said, okay, test beeped. 145. I was like, oh no. I was like, are you serious? I knew I should have ate that cereal. And she started laughing. I was like, oh. So I have to go back and do the 3-hour test. Oh, y'all. I'm so not ready for that. I really hope I don't have gestational diabetes. No, okay. I don't want that. So, but everything is awesome. Everything is everything. I feel incredibly blessed to be at this point in my pregnancy. 8 weeks, 3 days. My next appointment is February 8th. She says she wants to see me every 2 weeks. I don't know if I'll get an ultrasound every 2 weeks, but I think she says she's going to do ultrasound every month to check on the progress of baby, to make sure everything is, everything. But I think when I go in on the 8th, I'm going to ask her for an ultrasound, even if I have to pay for it. I'm going to ask her for one for my peace of mind, because I know that at that point, well, not if I'm still sick. If I'm still sick, then no. Because I remember the morning that I had that miscarriage, I woke up and I didn't even feel pregnant anymore. I felt completely normal. So, but if I still feel sick like I do now, then I'm not going to ask for one. But if I feel like I did that day, then yeah, I'm going to ask for one, even if I have to pay for it myself. So that's the plan. Other than that, y'all, that's it. That's it. There's nothing more to report. Everything is going good. I went to my lung doctor. He told me he can keep me on my medicine. They're gonna just monitor me closely. They want to do a CAT scan. He did tell me he want me on my oxygen 24/7 now, because my oxygen can drop at any point, and if I'm not getting enough oxygen, then the baby's not getting enough oxygen. So I have to have my oxygen all the time, even if I'm feeling like I don't need it. So everything is everything. So I just want to update you guys and let y'all know exactly what's going on. I really do miss y'all guys. I've been staying away from internet, anything that's negative on the internet, because like on my Facebook, I haven't been on my Facebook in I don't know how long, because you can't control what everybody says and post and everything. So I get so tired of reading things that just, I don't want that in my mind. So I I've been staying away from a lot of, like, if I know something negative, like if I follow somebody and I know that they tend to be negative or tend to have like cursing and stuff like that, I just stay away. I don't even view it. I just don't want that negativity in my life right now. So, excuse me, y'all. But I'm so happy for everybody. It's like seeing everybody who's like progressing in their pregnancies. Like some of them are just like more than halfway done, and like I remember like it was just the other day when they got a positive pregnancy test, and they're like halfway through. You know, I'm just like, wow. So February 8th is my next appointment. Probably be my next update if nothing happened in between. I have my um, genetic test done that day also. So I will probably know the sex within a week later of the baby, because it also tells you the sex. Yay. But that is off. That is my update, y'all. I don't want this to run on. Oh, excuse me, y'all. Run on too long. All that just to say them 4 words. So remember, more prayer, more power. Little prayer, little power. No prayer, no power. Y'all have a blessed weekend. Bye bye.